Hi, I'm Dr. Wang with Harvard Eye Associates. Today, we're going to talk a little bit about what cataract is and what's involved in cataract surgery. So cataract is actually something everyone's going to get. It's an aging process of the lens that we were born with. When we're first born, each person is born with a clear lens in one of our eyes. And as we get older, this lens becomes aged as well. Eventually, it'll start developing the first sign of cataract when you're in your late 40s and early 50s, except most of people will have the cataract remain asymptomatic for a period of time until you reach much older age. The vast majority of people in the United States get their cataracts removed between the ages 65 and 85. Usually that's when your vision dropped below safe driving vision, or when you start to experience a lot of symptoms such as much challenge with small prints, regardless of how much readers you use, and difficulty with driving. When you were much younger, you realize you drive without glasses and you see the street signs clearly fine. As you get older, the cataract will prevent you from seeing the street signs until you're right up against the stop sign or the light. That's when people realize, oh, it's not safe to drive anymore. That's a perfect time to start thinking about cataract surgery. Halo and glare is another thing that people tend to complain about their cataracts in their early stages, especially nighttime driving. You'll notice the oncoming traffic light, the headlamp just look like very unbearable, a big blob of light in front of you. Usually that's the first sign to bring people in their younger ages to come in to have their cataracts evaluated. To make this more visualized, I'm going to show you an eye model. This is a small eye model that we look at from straight on. I'll show you from the side view so you can see things clearly. Inside the eye, behind the cornea, which is the front guard of the eye, there's a clear lens in the eye. I'm going to take it out so you can see what it's like. It's literally like a clear M&M shaped chocolate. So it's, as I said, transparent when we're much younger. And then as time go by, especially with UV light damage, this lens will become more cloudy. And a cloudy cataract look like these. So these are the lenses still in the shape of an M&M chocolate, but it comes much cloudy in the center. It could be cloudy from the edges as well with a clear window in the middle. These are the type of cataracts where people may complain more about halo and glare, but not necessarily clarity. But this, with overall clouding, you're going to notice things are a lot dimmer, more blurry, hazy. Sometimes people would say, I feel like my glasses constantly has a smudge on it and I want to wipe my glasses all the time. So that's the reason, is because you start to develop cataract in your eye. The solution to cataract is actually to do cataract surgery. When to do cataract surgery is usually the first question patients ask me. So you actually, as a patient, get to be the judge on this. And obviously, it's a two-way decision where the doctor helps you to decide when is the perfect time to do cataract surgery. Like I told you earlier, most patients in the United States get their cataracts removed between the ages 65 and 85. That's when you also most likely realize cataract is creating vision symptoms to you. Trouble with small prints, difficulty with nighttime drive, color vision becomes more dull, not as vibrant colors as before, and other patients may complain reading requires a lot of stronger lights and you constantly want to just make the light a little stronger and stronger, or maybe changing your readers to a stronger power all the time. Those are usually early signs to tell you it's time to get cataract done. Another more objective measurement where would prompt a lot of you to come in to have your eyes checked is whether your eye vision is good enough to pass a DMV test. A lot of people would say, oh, I went to my DMV. They say I need to have my glasses checked. I can't drive without any correction in my eye. So that's usually another sign to tell you if your glasses is not doing the job to get you to drive safely, cataract surgery will probably be the solution.